That's right. I'd like to call the Health and Human Services Committee meeting to order. There are no appointments, but I'd like to get a motion to approve the minutes of December 1st.
I'll move it.
Oh, what?
Second? Okay. All right. All in favor?
Aye.
All right, great. As you see, there was one revision. We have 27 resolutions on for tonight. I'd like to kind of take them in order that makes sense to me, and maybe we can start with HH 25, which is the sole resolution from the Office for the Aging. And this is a authorization for the county legislature and the director of OFA to amend a resolution, replacing some wording in the resolution that I believe we passed last month or in December. These were the 2023 contracts, the funding that you get, and it was discovered by, I think Brittany made mention that there was wording in there that talked about the Cayuga County Administrator. And she felt that the resolution should be amended to reflect the chair of the Cayuga County Legislature, which I think is quite picky, but I'm no attorney.
Move it, Lydia.
Okay,
Second.
anyone opposed?
I'm slightly opposed, but I'm gonna go with it.
All right. Let's go with it. I hear you.
There.
Uh-huh. All right.
Yeah.
All in favor?
Aye.
Okay. All right, do you have you want to add to your report?
I'd just like to give you some visuals on the first bullet where I talk about the Medicare annual enrollment. Don't think I've done this in a while. I wanted to show you years and years ago with the Medicare health insurance counseling. We used to have this one sheet that listed, 9 companies that offered Medicare supplement plans. And they had a standardized system where they had letters at that point, A through F. So it's about half of what's here now. And when individuals needed Medicare, if they wanted to get additional coverage beyond what Medicare covers, they would look at the sheet, they pick one of these 9 plans and they pick one of the A through F coverages. And at one time, this actually included there were some prescription options on here in New York State. Plus we had the EPIC program in New York State for prescription coverage. So it was a really nice, tidy package. Now, since 2006 for the entire United States, but mostly 2012 for us, individuals who want some kind of Medicare additional coverage or different type of coverage still have all these options. But now they also have, just in Cayuga County, all these options. These are private Medicare Advantage plans. So there are probably close to 30. And this isn't all of them. This is just the ones that include prescription coverage. So all that advertising that people see all October, November, December, that really heavy advertising, full page, all kinds of things on the television and radio, that's what this is about. This is this new product, which is private insurance companies offering a private Medicare product called Medicare Advantage. And in this situation, when people sign up for this, the Medicare federal government sends whatever company the individual signed up with, sends these companies a monthly amount. And these companies then are responsible for taking care of the individuals who've signed up for these plans. Very, very heavily marketed. One of the issues that's coming about with these is that these they work quite well for people who aren't well and don't see the doctor a whole lot. They have a lot of extra benefits, often like eyeglasses, hearing aids, dental, gym memberships. Those benefits are limited, but they're attractive to folks when there isn't any other options for that type of coverage. Where we find they're problematic is that they are network plans. So it's really, really nice if Humana markets to you, but if your doctor doesn't accept Humana, that's a big problem. Or if the Humana product doesn't cover your prescriptions, it's a huge problem. So that's where our office comes in. When we meet with individuals, we're not beholden to any insurance company. So we look through these options, we look through these options, and we talk with the individual about what it is that they are looking for in terms of cost, in terms of coverage, in terms of access to to the insurance coverage that they need. Some people want something that's very low cost up front, but they're willing to pay if they're sick. Other people have so much going on with their medical situation, chronic health conditions, that for them it's simpler to purchase a product that is more comprehensive. That's what we help them figure out and decide on an individual basis. So one of the comments I had made is that it's taking us longer to counsel people. And that's because we have to work through all that advertising, work through all these different companies and different products, and kind of do a lot of education for folks. That one that they're advertising so heavily may not really be the one that works best for you. We still, obviously, we're not directing them to any plan. We have people that enroll in all these different plans and we help them do those enrollments, but we don't get any commission. It's totally unbiased and we're really just trying to work with the individual. In addition to those, there's also standalone prescription plans that we also help them get into, depending again on what their choices are. So I always bring these multicolored sheets because I like to share with you how involved our October, November, December process is for our insurance counselors. They go through a lot of training every year. There's constant updates from Medicare and just constantly kind of staying ahead as much as possible of the advertisers and really trying to give the community members an unpressured, unbiased option with our office. So just wanted to share that.
I'm glad that's not my job. Yep, sure.
I appreciate you, and all of our community should appreciate you. And the reason why I can say this as vocally as I do is I have a mother who is 80, who is confused the entire year through because it seems like the marketing that they're doing does it intentionally. The company who last year may have provided her benefits will send her a payment book and keep her old card. The new company doesn't send the new card in time, so she'll go to her, get her prescriptions with the old card, and then 2 months in a row, she's paying the minimum. And when she asks, why did I spend $1,000 already instead of just $500? And then what do? We're waiting 2 years to get reimbursed by Walgreens still.
Oh, right.
So where you guys, this is just the starting point, folks, of where this team helps people. But there are these other things that they probably have to field all year long. And I can't thank you all enough.
I give credit to the staff. It's our Nicole, and Shannon are the three staff that do this all day long, October, November, December. So they're very skilled.
Thank you. Okay. Anything
Thank you.
else for Brenda?
Thanks,
All
Brenda.
right, thank you, Brenda.
Thank you.
Maybe we could start, Lauren, with your 3 resolutions. I'm gonna go through each one and then we can group them together, get a motion in a second, and then people can ask questions. The first is for you to accept the regional OMH mental health state aid that comes to the directors in the planning group. Since Ray's been here, the money comes into Cayuga County and then you disperse it out to the 5 different counties. Is it? And this is, there's no money listed in here, but this is whatever the allocation is
To the region, yes.
that you'll get it through to the region. 23 is you're asking to fill a vacant full-time senior clerk position, has to be senior clerk, but there was a vacancy.
Yes.
Okay. And this is a budgeted position. And then 24, you're looking to enter into, is this a renewal
It's a
contract with a,
With a nurse practitioner.
and the rate now $150 an hour? and
Same
it's
as it
for
was.
up to 5 years now, so.
Yep.
Okay, same rate, and now the contract can go up to a period of 5 years. Unless it's amended, it will just exist as it is.
Correct.
Could someone make a motion for HH 22, 23, 24?
I'll make a motion.
I'll second the bundle.
Okay, now any questions on any of those 3 resolutions? Okay, all in favor? Aye. Great.
Just to, I just wanted to say, we did hire a therapist. It's been a long time, open position that we've been waiting to fill to be able to start mobile crisis. However, we did have a case manager that was ready to start, however, opted not to take that position at the last minute. So we have reposted the case manager position, but the therapist will start, February 20 something.
So I'd like to maybe talk to the committee about this, because I just saw Lauren had sent me an email, and we all know you've been waiting to hire this therapist so that you could start the daytime
Crisis.
mobile crisis. So great news, she's got the therapist identified. Bad news, the resolution is expired because it's over 6 months old. So we have two options. We can do a resolution, and the committee can recommend it be forwarded to Ways and Means to amend that resolution to allow this position to be filled, because HR is not going to let you fill it because the 6 month time frame has expired. Or we can potentially talk about having an emergency resolution signed by Aileen, myself, Dave, to allow her to hire this position that gave her permission to hire. It's just that the time has expired. So whatever the committee feels makes the most sense, but we have the person identified. You want to start her by February 21st. And we're going to need that some way that's resolved before the next full legislative meeting. So we can go to Ways, or,
I like the idea of getting it through Ways.
okay,
I support that.
Yeah.
okay,
Okay, so I already
think
have the
emergency
resolution. written, so-
Resolutions, we have to remember the first word, and that is emergency.
yes, I mean, right, this would be, you're not gonna want to lose her, but since we have the opportunity to go to Ways, then get it
Okay.
ready and we'll go to Ways.
Okay, yeah, it's all done, so. I can send
Okay,
it.
then we'll work through Amanda to, with the committee's recommendation to add it to HHS, and it'll say added at the meeting or whatever.
Okay.
Okay,
And wait for this next Wednesday.
Yep. And then just the other update is, the Community Services Board has been meeting, about the opioid settlement funds. We did a request for proposals and we got, I think, 13 of them. We've been reviewing them and have, made some we're gonna fund 4 initial projects. We're still gonna be meeting to decide if we're gonna fund any more of those, so that's still a work in progress. We just needed some additional information from those people who applied. So there will be a resolution coming forward next month for those 4 projects, to move forward, to fund those, to contract.
I was at a healing meeting and there was some people around the table saying, well, does that mean our proposal? I said, no, it means we're still looking at those kind of things.
Yeah, I think we're just looking to move some projects
Yes.
forward
Yep.
and then continue the discussion, and no, it does not mean
Yep.
that, so we're still
These
having a
are,
conversation.
these are $75,000 projects, except one is a $20,000 kind of wraparound. But yes, most of them are all, that's the maximum they could apply for, 75,000.
Mhm.
Most of them applied for 75, mixed together $20,000 proposal. But
Yeah. So I can give you some more details
Yep.
about those at the next meeting.
is that what your question?
Yeah, that was gonna be part of it, but how much do we have altogether?
So we have received, I think, 475,000.
Okay.
But that's without one payment we were expecting last year. So we anticipate to receive that
And that's just for this year, then they progressively.
for last
get
year. Yep.
less.
And then this year we'll receive some as well.
Okay,
And it's ongoing for like years and years.
18 years, I think, yeah.
And there's still some people settling. So still some pharmacists and some pharmaceutical companies that are still settling.
More to come.
Yeah, thanks, Laura.
Thank you. That's it.
Okay, thank you. Okay, Deb, do you wanna, you don't have a resolution, but you just wanted to sort of kind of fill the committee in about,
Yep, I have a few updates.
okay.
So I just wanted to add to some of the things that were on the update for this month. All the claims actually have now been paid out, so we are waiting for the state to reimburse us just over $77,000 for all of the 22 programs. So all those local agencies that we funded for 2022 have been paid. All the data that's come back to me on the program annual reports, I did receive all of the program data back. I'm looking forward to 2023 to actually observe these programs rather than just get the paper back. But all in all, looking at the numbers have been great with really nice measurable results. And based on the numbers turned into us, we've served in Cayuga County 3,000 youth for the different programs that we funded with our OCFS money. I still don't have the 2023 allocations. I know that we're getting them. I don't know what the number will be. I do have a monthly meeting on Tuesday with New York State OCFS, and hopefully they'll have an update for us when we will get those allocations. Once they come in, once again, then I'll put out the RFP for local organizations to apply for that funding. We are currently now in the process of recruiting our youth board. So if anybody knows of anybody that would be a good candidate for something like our youth board, interested in positive youth development and want to address local needs. I know that Heidi had recommended a name for me today. I've already put one through. We're looking for 9 members. I know Heidi and Lydia are working on some community members, specifically youth members for that board. So if anybody has any ideas or suggestions, please forward them to me and I'd be happy to reach out to the person and discuss more of that role with them. Let's see. Some other things that have been going on. I've just been meeting with different people in the community, specifically just kind of getting to know them and their programs and where ARPA funding may come in. I had a great meeting with Cayuga Works at Employment and Training and learned a lot about the programs they do, specifically to youth. They do a WIOA program with, that specifically works with youth with barriers. The cost of that is kind of a little higher than maybe we would want to fund for ARPA funding, but there are some other great ideas as well. We talked about doing like a youth shadowing program where we could pay money for incentives to get youth out in the community to try different job segments and perhaps provide gift cards, provide some other incentives such as they have you're allowed to support services for employees. So youth started in their workforce that might need steel-toed boots for that's something that they're allowed to fund. And I'm not sure if anyone is familiar with this program that they were really excited about. I guess it was a really successful program that ran from 2009 to 2015. It was called the Jumpstart 10 event. It was a youth leadership summit that
Spoke about it yesterday.
Okay.
Kelly did.
Okay.
Yeah,
It
saying
sounds-
your praises about collaborating.
Okay, yeah, it sounds like a wonderful event that we would like to possibly look at using some ARPA funding to get that back in our community. That basically targets 10th graders all in the Cayuga County schools to come in and do this leadership event. In the past, it was funded primarily by Cayuga Works and mainly with a grant and some other local grant money as well. And that served, like I said, all of the schools in the community. And it's held at Cayuga Community College, typically during their spring break. I had a nice meeting with somebody from she's from Southern Cayuga, Elaine Myers, and we spoke a lot about youth involvement with agricultural and some partnerships there that we could talk about for Southern Cayuga for that area of the county. And I also did speak with a gentleman recently about modeling a youth center, drop-in center here in the city, modeling after a town. It's called Township 5 Youth Center in Camillus. So he's working on a proposal for that to possibly get some ARPA funding. It started up, yep. He actually has the space already at the car building. He's looking to do a drop-in youth, like a safe place for 13 to 17-year-olds in the community. So he's working on that. But that's just some of the things I've been working on.
Oh, that's great.
Any
great.
questions?
Yeah.
I just want to make a comment. I want to thank Lydia and Heidi for both being on the board since it started, since we revitalized this board, but they've done a great job. And I want to thank you both for doing that.
Thank you.
Thank you. Thank you for everything that you're doing. I do have a question, and that is what I would like to talk to you afterward if I can about some thoughts I have for some members and some questions. And FYI, for the last thing you were talking about, my husband actually participated in the one in Camillus when he was younger.
Oh, really?
So, and that could be a good or bad thing because he's a bad boy.
I can't imagine that's true. Yeah, I know that's what they're modeling after with ours, and they're partnered with the Parks Department there, but they do a lot of nice outreach for the youth in the community. So if we can emulate something like that here, and then possibly get some other locations in the rural areas, because I know that's a really big thing. But start somewhere, I think would be helpful for the community.
Absolutely. Thank you.
Elaine, I do have one more.
Okay.
What is the age limit for the youth that you're looking for?
Under 21.
Okay.
Mhm.
Any low age? Can it be
13 and
13 to
grade and up.
Okay, good.
Yep.
All right, thank you.
No, I said good question. Thanks.
So let's go to the health department. Christine said she go last.
Well, I don't know. We time ourselves today.
This definitely isn't a July meeting.
No, it is
I'm
not.
just saying.
And I'm trying to say, there were a couple months at the end of the year, I didn't bring any resolutions, but I'm making up for it.
I think, that some of them, I mean, we're gonna separate HH4, I think, because we're gonna get some discussion about that. It's a change of position, but one is to fill a full-time public health nurse position, and that's a budgeted position in the budget. The 6 month has expired, so you have to bring a new resolution forward. Same thing with the senior public health educator,
That was a new vacancy.
a new vacancy, okay.
Correct.
Oh, yes, you're right. See, yes, so that's another budgeted vacancy due to a resignation. The supervising nutritionist position, HH3, that was the one that was 6 months old, that you've made some changes in the job
Qualifications, yeah.
with the state's approval, which might open up candidates.
So I'm very hopeful, just as a sidebar, that we have someone who's finishing school, very interested in finishing it in February. So we want to be able to offer a job to this person so they don't get snatched.
And then,
Then the public health nurse one also, not to get ahead of myself or you, but we have an internal candidate who may be completing her degree that we'd like to be able to offer that to one.
because the public health nurse requires the bachelor's in nursing, okay. HH5 is accepting additional funding for that ELC grant where you got the original $2 million to help the schools and yes, yep. And that is how much money, Kathy?
That one is $209,000.
Okay,
It was about 10% more of the original amount, and we had simply forgotten to add that language and any additional funds when we initially accepted the grant.
okay. And then HH 26 and 7, which are the two that she added. Unfortunately, you're asking to fill your WIC coordinator position because you just found out that Tanya will be resigning her position at the health department.
Correct.
And also HH 27, the Director of Community Health Services, Nancy Purdy, is looking to retire by the end of February.
Correct.
So these would be bills that you would need as soon as possible, and they're budgeted and,
Correct.
okay.
Yeah. Civil service is helping with our WIC position. We're getting that on to be reviewed, I believe, next week. Again, going back to with WIC, you have to get the federal and state people to approve things as well as the local. So I said, we need to have the minimum qualifications, shoot for what we want and the ideal, but we have to have the minimum. And I think that may open up for a coordinator position, a few more. So I'm very hopeful that the WIC positions may be able to be entirely filled in February.
Okay. I'd like to group together HH 1, 2, 5, and HH 26 and 27. Those are either the accepting of the funds or the filling of budgeted vacancies. And then you can go over HH 4 and HH
Sure.
6.
I'll motion the
Individual.
bundle.
Okay,
A second.
okay. Any questions on the ones we just discussed?
I just have a
Okay.
question or comment. Are you,
Freaking
this
out.
is a lot.
And this isn't, I'm not done talking yet. It's like talk more.
There's gotta be, I'm sure in your mind, as we've discussed, we're gonna internally and externally in the past couple of years, where you're headed as a department, and is, sometimes when we have these vacancies, it's a good time to assess and say where we're at and where we're going and what is it I really truly need.
I
Sure
really
that's all going through your head.
appreciate you saying that. So I actually did bring my preferred organizational chart.
Let's vote on the resolutions and then,
Yep, that would be great to have the opportunity to talk about that.
any questions on those two all those 1, 2, 3, 4, 5, 6 resolutions? All in favor?
Aye.
Okay, great. Now, if you want to get through 4 and 6, or you want to talk about your chart, whatever.
No, I'll go through the resolutions first.
Okay,
So
HH4.
HH4 is the request to reclassify the principal typist position, be reclassified to administrative assistant. That person really has been functioning in that capacity. Civil service evaluated the job duties, found that this was an appropriate job classification. We did budget the money in our 2023 budget for this role. So I'd like to be able to create, have that position created and fill it.
And this also talks about the abolishment of the principal typist that you're,
Correct. There's an internal candidate,
Yep.
as mentioned, and so
Yep.
then that position will be vacated when she assumes the new position.
Okay.
Resolution
I
goes.
think Kathleen made some changes to the original, the resolution itself, because the title now really is create and fill an administrative assistant position in public health due to the reclassification of a principal typist and abolish the principal typist. That's what the body of the resolution calls for.
Correct.
I'll move that.
I'll second.
Okay, any questions about that? All in favor?
Aye.
Any opposed?
Good forward thinking, we get it in the budget for 2023.
Yes.
And then
Okay, now VMC. That's
BNC. So one of the projects we have going on this year, there's a lot of focus on our preschool special education, which is our very most expensive program within the health department. One of the tremendously expensive aspects of that is transportation. The county is responsible for transporting children who are eligible to the tuition-based programs that they go to. As all of you know, this is a mandatory program that we administer through the health department. Again, no secret to anybody here, finding bus drivers, finding transporters, the cost of fuel, very expensive. A number of years ago, we created an RFP, a request for proposal, to go out to bid, to get bids on the various routes for transportation for these preschoolers. The majority of children, well, it's about 50% right now. Of the children going to tuition-based programs, it means in a class, going to a specialized classroom. There are a number of children, just to step back, who may go to preschool that's inside a school. There are a number of preschool children who may receive services at daycare or in their home as well. But for those who go to school like Gavra Center, we encourage parents to transport them themselves. Not every parent is able to do that, and we will reimburse parents for transporting their child. So then busing, it's incumbent on the county to provide the transportation. Primarily it's school buses. VMC is a company that specializes in creating transportation RFPs and helping counties with transportation needs. They have 20 plus years in this business. We've been in conversation with them. We have testimonials. We checked out some of their references. The counties that are working with them are very pleased with their services. There is a laundry list of services that can be gotten. The primary things we're looking for: write the RFP, distribute the RFP to as many transportation providers as possible, analyze the RFPs when they come in for utilization, because there might be one transportation company that will do ABC routes. There might be another that'll do DEF routes. And we want to be able to award those appropriately. And then be available as needed for some conversation. The cost is $36,000 that can be spread over 2 years. So $18,000 this year, $18,000 next year. We have looked in this resolution to take that money from our transportation line within the budget, move it to professional services line, because it is a professional service if we're able to contract with them. In my opinion, this is an area of expertise that no one in the county possesses. We certainly don't have that in the health department. For the cost of what we spend, which on average over the last few years has been about just shy of $350,000 in transportation, to spend this amount of money to attempt to control our costs as well as we can, it is worth the effort. And we have to send these RFPs out anyways. And there's a time element to that, because of course it has to be written, has to go out, you have to have time to respond. And the current contract expires at the end of June. This is the time for us to get moving on it. So I would like to enter into contract with BMC.
Can I get a motion for authorizing the chair and the public health director to enter in a contract with BMC Transportation, and a second?
I'll move it.
I'll move it.
Okay. All right. Do you have questions, anybody?
I have some questions.
Okay.
Sorry, just to understand this. So you're actually hiring this third party to process the paperwork?
No, to write the RFP.
Okay.
We don't have that knowledge base. We don't have, like, We don't have a purchasing agent to help us send out the RFP. We don't have someone to write all the necessary requirements because there are state education requirements for who can bid on these. You have to have a certain type of driver's license, like school bus drivers, right? But you know that you have to have a certain driver's license. So I can't say I'll quit my job and drive kids. Nope, I can't do that. So there are some specialty areas. And then we don't know all the transporters. They're going to send it out regionally and around the state. I don't know. They're going to send it to places like the scat van type transporters, but out of county also. Maybe there are some people in Onondaga County who can come in and pick up some of the children who are along the border but again, that's not a skill set that we possess to perform that. And then the analysis of it
Yeah, the analyzing the bid.
is a huge one.
Elaine,
Go ahead.
where's this group out of, Kathleen?
Buffalo area.
They're from Buffalo? Anything closer? Really?
We're not aware of anybody else who has that expertise. I do have information of counties around us who have used them, and it's not just the big counties, it's smaller counties as well. And like I said, there's a lot, like some counties use them ongoing. You have, your child needs to be picked up, we call BMC and they arrange for it. We're not looking to use them ongoing. We think we just need them to get us jump started. That's our intention.
That's good. I just thought maybe somebody,
Yeah,
but that's okay if that's.
we're unaware of anybody who has that. And NISAC, actually, they've gone to the NISAC meetings
suggested.
and worked there because
Thank you.
they're pretty
The
specialized.
bid you had worked off and just pasted and copied because they had initially worked on years and years ago or?
Well, I think about 20 years ago.
Right.
And really, this might have been when you were working in the deputy position, if I recall correctly, you know. So we're going back maybe
Right.
more than 20 years ago. It has not been reevaluated. And even if we were to use the same RFP,
Right.
we don't know
I'm
use
not.
that to,
Yeah.
and we don't know how to
Yeah.
analyze it. It's just, and I don't know anyone in the county who has that expertise.
And I think it's gonna be grossly expensive. Transportation is anyways, but if we can do anything to minimize that, I don't know, I think it's worth the investment to try to at least cut the cost.
So this request is strictly for writing the RFP? Am I?
Writing it, mailing it out to the people,
Going to the.
getting it
bidders
returned to us, looking over all the returns, identifying this company can do these things, this one can do these 4 things, this can do these 3 things. This is your best buy.
And this is $36,000 to have to do that.
Yep. And then be available to us
2 years.
for some critique, and they'll be available to us for some questions. Yep. Yeah. And
are they still looking at per child, per bus, all the way you, that you?
all the various ways. So we actually
Which is more
had, I
expensive
just
or-
had to send something to our current transporter. One of the ways that children in the city of Auburn were paying is per bus. So if we can get 8 kids on a bus, great. The way we're paying for out-of-county children is per child, not per child, it's per hour for the driver, as well as for the aide. Most buses need an aide, not all of them. And there's a 2-hour minimum. One of the things that happens, for example, in September on Labor Day weekend, we got a call for Gavra Center, had hoped to have 3 classrooms open. They were only going to have 2 classrooms open. That left 8 children without preschool to start after that weekend. Some of those children are being served elsewhere. Some are not being served. Some of them were able to get into a Cortland program. We were scrambling to try and find transportation. We did not find it for a couple of weeks, but that's the kind of stuff that, you know, we try and we do, and we do the best we can, but it's ridiculously expensive. The transportation in general is. My thought is anything that can bring some expertise is better than what we've currently got.
At one point, if you have a child needing to go outside of a route, you're talking 200 and
We're
400. I mean, it's very,
it's very where we're going. So for example, the children, the children who are going to go to Gavris, who live in the northern, slightly north of the city, are being picked up from buses that are here and being brought down to Cortland. The children who live in the southern area of county and are going to Cortland are picked up from buses that go to Cortland and then go back there. We have a secretary who's making these phone calls right now, and God bless her, she's doing a great job. Not her area of expertise. We would love to get more of we have a child who lives in Auburn who goes to school in Syracuse. One bus can get him to Skaneateles, another bus can take him from Skaneateles to Syracuse. Again, I don't know how many hours we spend of our secretary's time trying to coordinate something like that. That kind of work should be done by people who have the connections and have the expertise
Yeah,
in
logistics
facilitating
really
that.
isn't any different than a private business managing their logistics. When you describe what you're describing, you'd have to have a logistics manager. Those bus routes.
Now, is there any way to quality assure that it saves us money? Not unless we come back and next year we pay less money. Everything's gone up in price. So to be able to compare that, it's more or less gas. So I can't promise you it's going to save us money. It's something we have to do regardless, is send out this RFP. How we do it is up to us.
I have another question. Okay, so I'm assuming this is budgeted.
Yes, so we have a transportation line in preschool that within the body of the resolution, we requested to move $18,000 into our professional services line for this year's payment. Next year, it will be budgeted again, assuming that we go into contract with this group for $18,000.
This is a 2-year contract, though,
It's a
that can be
2-year
paid
contract.
over the course of 18 each year.
With the majority of the work upfront.
Yeah.
And are we entitled to any support from the state or the federal government to
No,
reimburse that?
all local tax share
Does the state,
for the transportation for pre-K. If there's some early intervention that we have to, there might sometimes be some. And I would, if you've got more questions about that in particular, I would rather bring in our finance experts. We have people who this is their only thing that they do is work on the more complicated budget and claiming for preschool special ed.
any other questions?
I don't want to get. I don't want to get in that kind of detail.
Okay. All in favor?
Aye.
Any opposed?
Thank you. So those are the resolutions. So I'm going to refer to the resolutions. You all sent a report in. And so it's talking about, again, for those of you who haven't had the opportunity to tour the health department, I encourage you to do so and you get to see some of the people and learn more about some of the programs that we offer. I was asked to participate as a board member for our NICEHO Board of Directors. So I agreed to do so. It's completing a term that was expired. So it's kind of giving them a chance to try me out and me a chance to try them out. The community health assessment, I brought in a binder that may be circulating. I am going to ask if I could get that binder back when you're done. I want people to, but anyone who'd like a hard copy, I want to make one for you. That's the assessment that we worked on with Auburn Community Hospital. The state requires it. It's a multi-year plan of identifying health needs within the community, both identified statistically and also identified anecdotally for people completing surveys and interviews. There's a number of highlights which we'll refine a little bit more, but for example, opioid use and maternal and child health is one of the areas. We actually, as a health department, along with the hospital, applied for opioid settlement grant funding. Now, we're not in the first round, but we're glad to know that it's still going to be considered. Maybe that will help fund a start-off project that we can work on to assist as we are rebuilding our maternal child health program. Well, there will be a press release that goes out. And it's a joint press release between the health department and the hospital. It hasn't yet, so I've just got the links here, but things will look a little prettier in a little bit when we get that sent out, but that hasn't gone yet through our two agencies. But the other one was talking about federal funding that we're getting. So we had, as we talked about last year in March or so, we found out that our state aid was being increased. And that was great news because it was an increase in our base grant, and it was also allowing us to claim up to 50% of fringe benefits for state aid allowable costs. Preschool is not state aid allowable. Nearly every other program within the health department is. So that's the good news.
The fringe benefit package of the employees of the health department is reimbursed as long as it stays under 50%. I think that's my understanding. They're
Yes.
paying this fringe benefits.
That's a huge benefit to the local tax base. So that was good news. Along with that, we get some performance incentive money. And we just got word that the performance incentive project that we worked on last year will be getting $22,000 to enhance our state aid. So our base grant goes from $750,000 for 2023 to $772,000 for 2023. Great news. Now we're getting word that State Department of Health had applied for and received federal funding. Half of their federal funding is mandated to go to local health departments. It's the Strengthening U.S. Public Health Infrastructure, Workforce, and Data System funding. Cayuga County will be receiving for the time period of 2022 to 2027. So obviously 2022 is gone. So from now for the next 4 years, $648,000, $48,178. This is great news. We have not received the contract that speaks to the parameters of how we can spend it yet. So that brings me to what I want to discuss with all of you. And to the point that you brought up, Aileen. Thank you. This is my wish list organizational chart. We have our Community Health Services Director, who is resigning. She's been wonderful. We're so pleased, giving great notice, but she's going to move on to other things. She's leaving at the end of February. I'm just saying as an aside, that's someone who's a bachelor's prepared nurse and years of experience. I'm working with the state because we know it's going to be extraordinarily difficult to hire someone who's got that skill set, the education and that skill set. I don't know how our programs may or may not need to be modified without someone in that role, because that individual's nursing license is part of the certificate. So our licensed home care and our diagnostic and treatment center require that. My conversations, I've had a couple, they've referred me to another office in Albany. I don't know what our medical director, whether his license can be utilized in that capacity or not. So we'll be finding out more. So I'll just be kind of keeping you all updated about that because it's necessary. Our WIC coordinator position, I spoke to the fact that I am hopeful with the revised minimum qualifications that we should be able to identify some people with skill sets who may be an appropriate fit for that. A big part there, it is a preferred bachelor's degree, but you have to have supervisory experience for sure, working with personnel. And you have to want to work in that program. Okay? It's a great program, but you need to be able to do that. Next month, I'm going to be bringing forward a few more resolutions because we have some more planned retirements. I say this, I'm sorry to see all of these people go because they're so great at their jobs, but they've earned the right to do it. But it's going to be an incredible loss of institutional knowledge. So whatever we can do to get ahead of the game, to start cross-training individuals and to put people in place who have the expertise to perform these duties will be wonderful. Our coordinator of children with special health care needs is retiring at the end of April. She's already pared back her hours in order to use up her benefit time. I do think we should be able to have some candidates internally that may be eligible for that position. So I'm going to be bringing forward a resolution next month, request to fill for some overlapping training time, and then any backfills that may occur. And then our environmental health director will be retiring.
Oh, wow.
I know. We do have a plan to attempt to fill her shoes to the best of their ability. We currently have a public health engineer on staff. We believe that person may be a good candidate. That individual is going to be on leave at the end of February, beginning of March. So I'm going to be bringing a resolution to request to fill behind, a temporary fill behind that person's leave, and start looking for a public health engineer to fill that role. In the best case scenario, we find a public health engineer to fill that temporary role. Eileen is still here as our director, starts training this person. The individual who will be out on leave comes back in August, the same week that our director will be departing. And we hope that individual will then go into the director role, and that public health engineer can then become a permanent staff member. That's our plan, assuming we get permission through the resolution process to do so. In February, I'm going to ask to fill behind the leave of absence. Later on in the year, I would make the request to continue the rest of that plan. Also, here's my big ask for succession planning, for good management, for all sorts of reasons that I can get into. I want to request a deputy director for the health department. I think it's smart for the organization. It's something the organization had at one point in time. Then when it split from social services, there wasn't one in that split. I've been asking for it for years. I could not stress how much important it is this year that we get it. 1 vacancy, 2 vacancies, 3 vacancies, 4 vacancies in leadership. I need somebody. I need somebody. This role, the supervising public health administrator, I'm looking to change that job description to better suit the functions that are being performed by that role, and call it the Director of Education and Public Information. So we have administrative services, which is our money. We have education and public information. We have community health services, which oversees the WIC program. That's our communicable disease, our vaccines, our WIC program. We have our children with special health care needs. That's our early intervention and preschool special education. We have our environmental health services, which is our sanitation, our water, our food, vector-borne disease control. If I alter this position, it will come out of the union because it is a management level position. They do oversee a number of personnel. They do participate in evaluations. It's not appropriate for that person to be participating in any
It's not your deputy.
anything
right?
anymore.
The deputy will be out of the
That's
union,
the
but
change. I want this role should be a director. This role is to fill the deputy.
because the other people, the other directors are not in the
These are,
union either.
all of these
Yes, okay.
are not unionized. All of the yellow are not unionized. Yep. This is a role at the job.
Overseeing all the public health education and public information.
Educations and the fellows and the information. You know, I was talking with Elaine, I was talking with Hans, I was talking with a few others. You know, I think people forget that the health department is a 24/7 operation. And an example of that is when Cato's water was out. We're not the first responders, but we're the second responders. So here it is, Wednesday night before Thanksgiving. Eileen gets a call, I get a call. We work together. We work with EMO, we work with Dave, we work with the village, we work with public information. Thankfully, Eileen picks up her phone. I pick up my phone. Our public information person picks up their phone. It's really important that there's some redundancy. Eileen will no longer be available. I want the person who replaces Eileen to learn how to do their job, but I'm going to have to help orient that person. I want the communicable disease control person when there's a measles outbreak, just example, when there's a disease that needs to be attended to immediately, which that certainly happens. To not only be able to call me, but to be able to do their job, and I need to help orient them to that. I need to help orient the new preschool special education, children with special health care needs person. Unfortunately, our WIC coordinator is leaving just before our community health services director. I'm going to have to be helping at WIC. I'm going to do all those things. I can't do it all by myself, though. This is the time to get a deputy director. I have the money to do it. What I'm planning to do, again, assuming we get the okays, is when we get the contract for this federal funding to bring forward the deputy director position, then I can show that that position is nearly or entirely covered by that grant funding. That will be for 4 more years.
So you use that funding to add to the 0.1 so that you
Correct.
have the salary money, and that would be
Not
offsetting
impact
revenue.
budget. Exactly. And not impact our budget this year, next year, for the next 4 years, and it will then be built in. All of these positions, aside from this, all of these are state aid positions. So that's the good news, right? There are means of revenue, there are means to offset the local share.
When does that money come, do you know?
Well, they've been talking about it. They got the award notification in December. We talked about it in January. They were hoping to have contracts in February.
Soon, though.
Yes, it's very soon. It's very soon, but we don't have it yet. So that's why in February, we know about environmental health. We know about children with special health care needs. I'll be bringing those resolutions for sure. But I want to talk about these with you first so that you understand why I'm doing it. If in the next week or two we get this contract, I'll bring that deputy director position request as well. I'm again working with civil service to make sure the job descriptions are accurate and to classify them appropriately, and then show that the funding will offset those costs.
Have you talked to Diane? Is there, what grade would that be? Do you know? Have you talked?
For the deputy,
Yeah.
probably a grade 6
Okay,
in the non-bargaining.
Yeah, she'd have to do all the analysis of
Yeah.
that.
I just didn't know if you talked to Diane yet.
Oh, yes,
All
I've
right.
spoken with her.
Thank
Yeah.
you. All right.
Any advice? I'm going to be sending the job descriptions around to everybody, and I want you to ask your friends and neighbors to apply if they qualify. If they're good candidates. We don't want duds. We want good candidates.
We don't know any duds.
Yes, right.
Good, yeah, good. And I think we don't want some duds.
We don't.
I know a couple
Oh, yes, yeah, some duds.
I have a question.
Go ahead.
I have a question, Kathleen, and thanks for all that you're doing. The lead offerings that you've made, the outreach for lead assessments, what kind of responses are we getting?
I don't have that information, but I'll find out. Okay. Do you have a sense, Eileen? Did you know?
We're not getting a great response, which is unfortunate. So if you can spread the word to people, because we really want to change from being reactive to a poisoned kid to actually prevent the poisoning from happening. And we're very frustrated that we're not getting, you would think the phone would be ringing off the hook.
Do you think there's any way some of the local pediatricians could sell it to their to their families that have kids under 5, like, see if they can talk to parents about,
The pediatrician?
yeah,
We've been talking, our staff has reached out to the pediatricians, the OBs, family practitioners. So they all are very much aware of our program.
And not making referrals either.
No, we're not.
Yeah.
getting
A
the
lot.
referrals that we would like.
There was, and we don't know what's gonna happen. We know some of the highlights from the state of the state that the governor had earlier this week made mention of maybe even changing some of the other requirements for property owners who rent and mandating that as mandating lead tests as part of being a renter. But I don't know that that will go through, but it's a chance for people to get ahead of the game if that's the case.
Yep.
And we do mobile homes, houses, apartments, you can be a renter or an owner. You don't have to own it to have us come take a look.
Kathleen, the surveys, I know you were looking for like 1,000 and you made a lot more than that, right? Or they
A little
returned.
more than that. Yeah, but we did
Okay.
get over 1,000. Yeah.
Okay.
Yeah.
Right. Thank you.
Jim?
So I want to go back to this deputy director thing. This 600,000 that you mentioned, and you said it would be good for, 1 year, 2 year, 4 year, and then it would be worked into the budget. So when the money runs out, it will get added to the budget as a taxpayer item.
It would. But frankly, 4 years from now, who knows what the staffing is that we'll have. I believe we can absorb that. It certainly is state aidable. And I don't know how many staff and what type of staff we'll have. I don't know how we're going to be able to fill the nurse. But yes, that would be the case.
This 600,000 is over a period of 7 years.
It's 5 years, but it included 2022.
5 years.
So 2022 is passed.
So you're going to get a certain amount each year. They're giving.
I don't know how they're designating it to us. We don't have the contract. But I would anticipate it would be an equal amount each year.
Fair enough.
The plans. Can you share a copy of your organizational chart? I don't need to want to be micromanaging world of this, but I am interested just because I just want to see a picture.
Sure.
But I do appreciate all the thought because I made the comment. I'm new on this committee, so I appreciate everything you put into. I'm sure you were awake at night thinking about what's going to happen to this department, and I appreciate all the work that you're doing and the strategies you've come up with.
Thank you. And I knew it would be quite the conversation. And we requested that Amanda put on the agenda, the WIC coordinator and the director of community health, because I got notification of those just this past week. It was after our typical deadline. But the other people, they're very much planned and had given ample notice to us, which we're so grateful for. And I console myself that people are leaving because they have the right to retire, not because they don't like their job.
Right.
Thankfully, they stay because they do,
Nancy, right?
and they took the job because they do, so I hope we can find people who are even half as marvelous as they are.
Thanks. Thank you.
Thanks.
Okay. Christine? I actually asked, talked to Christine about actually kind of grouping some of these resolutions together so that we could sort of group them all together in terms of, I think the first 11 of them. No, HH7 is really accepting $52,000 to safe harbor. I'd like to just kind of go through all the contract renewals, get a motion all at once, and then we can ask her any questions.
Right.
HH7 is to accept $52,020 and entering a contract with Booker T. Washington for safe harbor. And you read the resolution, it's dealing with sexually exploited children, trafficked or at-risk youth. And this, I believe, we got these funds last year as well.
Yes.
HH8 is enter into a contract with the Cayuga County IT Department for the provision of services. And this contract, we have a contract with IT, Department of Social Services budgets. That contract amount reimburses the IT department for the work they send specific to the Department of Social Service. And that makes those expenses eligible for state and federal reimbursement. So it's maximizing federal and state money when we do it this way.
I thought that was very clever.
Same thing with HH9, which is entering into a contract with Cayuga County Sheriff's Department. We budget for the cost of the special patrol officers that do security for the building. DSS puts it in their budget. They pass those costs over to the sheriff's budget to make them whole. and that expense is then reimbursed state and federal. That's an ongoing contract as well. HH9, we enter into a contract with the Sheriff's Department for the provision of, oh, sorry, I already did that. Excuse me. HH10, enter into a contract with Catholic Charities to provide SSI maximization for safety net and temporary assistance cases. They're both two types of public assistance cases. And this contract has been in existence for a long time, helping those that are eligible for SSI to become SSI eligible and get off public assistance. 11, enter into a contract with Catholic Charities of the Finger Lakes to provide supervised visitation for clients referred to the Department by Social Services. This is a contract renewal. This allows this contract agency to do those supervised visits for kids in foster care, not tying up the casework staff, and as considered a preventive program, reimbursed at 62%. Longstanding contract. 12, enter into contract with, oh, this is the big one, Cayuga Centers for the number of programs: family preservation, family support, enhanced foster care program, and MST, multi-systems treatment, I believe. And those are mainly your preventive contracts. This resolution passes. These are contract renewals, the amount not to exceed $550,000.
Yes, and the actual cost of those programs is higher. They reimburse through Medicaid for whatever they can, so it's up to 550.
And if the more Medicaid billing they do, the less you guys would pay.
Correct.
Okay. They're enter a contract with Children's Home of Wyoming to do recruitment, training, and retention of foster parents. And if I'm not mistaken, we went out to RFP a number of years ago, awarded it to this, very pleased with their work.
Yes.
This would renew their contract for $229,000. Next is the contract with the Community Action Program for the provision of non-residential domestic violence services, and Department of Social Services is responsible to do this work, and you guys provide this through the contract with CAP.
Yep. Great plan.
Enter into a contract with Chapel House, temporary homeless shelter for men. This is Grant Ave or Franklin Street.
This is the Franklin Street Men's Shelter.
Okay, and the new per diem rate is $81 a day, and that is an increase in rate, but there's been a lot of analysis done about what it is costing them to provide this service. And
Yep, and in particular, their bed numbers went from 19 to 15. So the reduction of the beds, they're not able to, they need to spread the costs right.
Yeah.
No over the 15 beds as opposed to 19, so their rate went up $100 per diem to 81, and they also had some increased costs with staffing.
authorize the chairman and the commissioner to enter into a contract for daycare services, and you have a long list of daycare providers that you actually use the daycare block grant to subsidize eligible daycare.
Yes.
And then lastly, HH 17, enter into a contract for support and maintenance of the Qmatic Corporation for maintenance of software installed at the intake unit. And basically that's on the third floor, and people take a number.
Yep, the ticket system on the third floor for folks coming in for temporary assistance, helps manage the flow. We guide them to the right window to talk to the right person.
Okay, so HH 7 through HH 17 are, the majority are contract renewals, all of them accepting that money. If I could get a motion and a second, and then if anyone has questions about those contracts, we can ask them.
I'll make the motion.
Second, the motion in one bundle, HH 7 through 17.
Okay, any questions on those contracts? Jim?
So it was mentioned during this presentation that there's reimbursements for all of these, some of them.
Most of them, yeah, most of them have at least partial reimbursement through state and federal, depending on the type of eligibility, programs we're talking about. Some of them are federal, that's 100%, TANF is 100%, some of it's state, 62%. Some of it's, not quite as high, a 29% reimbursement for safety net for adults in the Chapel House shelter.
So when you were working through your budget for this, knowing that these were coming up, you were doing that math, I'm assuming. I'm asking because I don't know, I assume you do all that math and hope that it all zeroes out to cover the cost.
Well, that would be great if it covered 100%.
No, but I mean, between what you budgeted.
Yeah, we try to maximize the reimbursement.
What you anticipate coming back, because that changes.
Mhm.
Okay.
We've been very fortunate. Our director of admin, who there's a resolution on tonight for, she is moving up, the finance director here. So she has an incredible amount of knowledge about that. I mean, it's very DSS reimbursements and structure of reimbursements is very complicated.
There's always a lot of conversation about how we can do it to maximize the best amount of state and federal
Right.
money.
Even
That's
like with the security.
Yeah.
Even with security and IT. I mean, I don't know if every county does that, but it does. It helps it, bring down the cost to constituents for taxes. And, we do try to do that as much as we can.
That question. Yep. This may be a little weird, but what are non-residential domestic violence services?
So residential domestic violence is where folks are put up in a shelter because there's a domestic violence situation happening and it's not safe for them to be in their home. Non-residential is counseling for them, helping them get to court, helping them fill out paperwork maybe that they need for an order of protection, helping them figure out financial, supports that might be available to them while they're in this transition. So it's all of the things that aren't the housing, the residential.
Thank you.
Okay. You bundled them all in favor of HH 7 through 17?
Aye.
Any opposed? Okay. That just leaves, if you want to go, HH 18 is to fill a supervising social services attorney position in the Department of Social Services. HH 19 is to fill a director of administrative services, and that's the position she just referred to. Grace is taking the job at finance department. And then 20 is filling 3 human service examiner positions in the Department of Social Services. And the supervising attorney is a budgeted position, but you just got a resignation from your supervising attorney.
Yep, she's leaving at the end of this month. That was kind of unexpected. She's going to be leaving. So we actually already got in touch with Diane. She did the salary study to make sure that the position is placed in the appropriate band. And we did that for the social services attorney and also for the director of admin.
That's the goal. When the vacancy occurs, that's the time to relook at the position.
Yep, and they're both budgeted positions, and we're looking to fill them as soon as we can. They're both key positions for us.
And 20, you just have 3 human service vacancies?
3 more.
Oh,
So 3 more. I've been here in the last few months, asking for human service examiner fills because we have this, I think I said last month, we flipped from caseworker vacancies being our main concern to our temporary assistance area, the human service examiners. We have with these 3, 1 more we're anticipating is going to be resigning. We'll have 8 to fill. So today
in the various programs.
In the various programs of temporary assistance, SNAP or intake, Medicaid, child support. I mean, it's across the board. It's we're working to fill them. We have a list that's not even as long as the number of vacancies we have though. So it's going to be a stretch to get them all filled and get everybody up to speed.
Okay, so could I get a motion for HH 18, 19, and 20?
I'll move it.
Second. Any questions about those filling these these vacancies? Go ahead, Dave.
Yeah, because it's going to be tough to fill Lisa's position, isn't it? To find an attorney that is knowledgeable about that,
Well, we have 2 internal,
that may be
attorneys,
promoted up.
that may be interested in that. And then, we'll be looking. I don't know. I'm not sure what the interest will be.
Yeah, okay, thank you.
Hopeful.
So I got a motion and a second. I did. All in favor of those fills? Aye. Okay, great. Lastly, this is interesting. You're asking to fill a senior social welfare examiner, grade 17, and abolish the higher principal social welfare examiner, grade 19. And this is all started due, someone retired and you relooked at the position and you're asking to make the principal then a lower grade senior.
We actually had a few principals retire, and that gave us an opportunity to kind of look at our structure and to see if there might be a better way to organize the units, organize the supervisory structure in those units. And we came to the decision that we would be better able to utilize the senior social welfare examiner over a principal. We're able to, they can carry a caseload, a little more versatility, they can carry a caseload, they can provide supervision for workers. We can move them around as we need to, not as much ability to do that with the principal. So I think this is going to give us more flexibility and be a better fit for the temporary assistance area that we're going to put them in. So yeah, so it ends up being a grade 17 position versus a grade 19. We would be abolishing that grade 19 principal social welfare examiner position.
Can I get a motion for that?
I'll move it.
Thank you.
Any questions? All in favor?
Aye.
Okay. That's a lot.
Oh, boy.
It's a lot. I mean, right now, I mean, as you can imagine, I think getting our positions filled and, just covering the work, with these people leaving is going to be our biggest challenge right now, starting out the year. We'll get there. There's going to be a lot of work.
Does that take as much training? Oh, hi. Yes, go ahead.
Are these like all civil service type?
They're all civil service.
Interesting.
Almost all the county is.
Yeah. Oh,
Right.
Jen would know the answer to this. Where does the $10 go when you pay?
Well, it's 15.
Oh, it's 15, okay.
And depending on the exam, some of them are actually 25.
Uh-huh.
Half of it goes to the state and then half of it is revenue per year.
Okay. We were talking about that the other day.
Yeah, I did find that out. but
Oh, we did.
What we don't know now is, and that's another conversation, I'm sorry. I was just curious if they were, because we're talking about civil exams and how much trouble it is, and they're once a year, and there was a person up here the other day that touted about, having somebody in a position where they go provisionally.
Provisional.
Diane did send out an email today regarding that. I don't know if you've seen it.
Is it a deterrent ever to taking the exam, you think? The cost?
No, because you can get it waived, the cost.
Oh, you
I saw that.
say,
That's
yes,
that's
okay.
I don't know how you get it waived.
Yeah, I don't think the cost
I'm
is-
poor.
No, I think the cost is the barrier.
No, I don't.
We're trying to figure out, I mean, everybody's putting, wonders like, how do we bring more people to the table?
What is the minimum cost for a human services?
What,
I didn't hear the question.
A minimum cost for the human services examiner.
You have to have a high school diploma and a year of experience.
Oh,
in
okay.
Some kind of customer service, clerical.
Okay, so it's not a.
It's not.
Mhm.
Pretty low level. It is. What is it called? I actually wrote that down because I thought somebody would
Because you
ask.
knew.
Honestly, it doesn't pay that well, in my opinion, which is why we have trouble, 39,000.
And it's, what is it, 37 hours?
35.
35 hours.
We're losing them to other county departments.
Yes.
Right, yeah.
Human service workers this past year.
It's not just you, but
It's not- Right, it's not just you.
yeah.
We've got at least
Yeah.
3 of them.
Mhm.
Yeah.
So that's what's happening, and we've lost some to court. Court started hiring, and I think I talked about that last month.
Oh, they had court problems.
So courts, hired a couple of them.
As
And
case manager,
what's that?
in case management roles.
I'm not sure what the.
No, it
just
No,
administrative.
it's administrative rolls over in the
Assistant
court, the back house offices of court.
Yeah.
So they scoop them up and, right, I mean, just like Kathleen said, I mean, good opportunities for them to make a little bit of extra money, definite impact on us and the staff that are here. And, we have some things happening, with some changes in Medicaid and SNAP that's gonna really tax the workers to get paperwork out that they haven't had to in a while, because SNAP is decreasing the allotment. There was an emergency allotment that has been through COVID that gave SNAP recipients a higher level of benefit than they had before. It's going to go drop back down. We anticipate huge volumes of calls and concerns from people. They've been living, and using the SNAP benefit to meet their budget through the month, and 2 years later, 3 years almost, they're going to drop back down, and you know, it's gonna be overwhelming.
Yeah.
And then, you know, Medicaid, people haven't had to recert in almost 3 years. Certifications are starting again. Workers have to do work to push out all the information about recertifications. Again, there's people that haven't ever had to do a recertification and provide documentation and paperwork to the department to recert, and they're gonna have to do that. And so that just a lot of questions, a lot of calls, a lot of volume of people that are just, you know, just don't know how to do this and need our help. So without our staff being at 100%, well, it's gonna be even harder for us to kind of rally and do that extra additional, you know, work around those things. So it's not all doom and gloom though. We do have good things happening as well.
And your case works.
Let me think of one. This is a good one. We have a peer that's going to be embedded in our child protective services and foster care unit that's out of Nick's Ride. That was through a grant through Healing Cayuga that I guess we found out about a couple of months ago, but it's getting kicked off. They've hired a peer that has lived experience with Department of Social Services Child Welfare. And this person's going to help support people that we identify that have substance use needs, concerns, and are involved in the child welfare system to try to help support them through that. I talked to Ashley for quite a while about some of the struggles we have with keeping people engaged in, you know, working with us to, you know, have reunification happen with their children. It's hard. There's a lot that they need to do. There's a lot of court work, you know, that court ordered things that they need to do. And I think having a peer that can relate to them and help support them through that process is gonna, you know, provide something that we just really can't, even if we're as supportive and helpful as we can be. It's just different when it's an actual peer that can help them.
I think the opioid funds, if I'm not mistaken, is going to embed a peer at the hospital.
Yeah, I wasn't sure I could talk about that. Yeah,
But yeah, she did,
Okay.
she basically did send the mail.
Okay, so that's another peer. So that was something that we found too, is that folks that are in Auburn Community Hospital at the BHU or even on the medical floors and have substance use issues are and don't have a place to live, are discharged from the hospital and have to come here to DSS and work with our temporary assistance department on the whole intake process, trying to find a house, trying to, you know, determine their eligibility. It's overwhelming. They have a lot going on. And so having a peer help walk them, you know, from the day that they're discharged, bring them here, help them understand the process, make sure that they, you know, get where they need to go and follow through with turning in the things that they need to turn into us, can help them stay eligible, help them, you know, stay on the right track and, you know, to be healthy and also to have a place to live.
And even if they had to be hotel, they could work with him to get.
Oh, sure.
The hotel.
As quickly as possible.
Yes.
Mhm.
Yeah.
So those are two, I think, really exciting things that are gonna be happening this year. That's better.
Thanks for ending on a high note.
Okay, anybody else?
Great job, Chris.
All right, thank you.
so much.
Okay, anything else?
Oh,
I think we just have to just discuss it for information only. There is a copy of Ledge 1 that would be for information. It'll come up at the Ledge meeting, and this is a follow-up to a letter the Board of Health wrote. A resolution encouraging the governor of New York State to direct the New York Department of Health to complete their review of the proposed draft rules of WASCO watershed rules and regulations. So this is the resolution that you guys put together in response to also having the legislature support the review and approval of the revised rules. All right. Nothing else? Motion to adjourn?
I got a question about that. I'm sorry. So this Wasco Lake thing, wasn't something on this done like last year and the year before? As mayor of the village of Fairhaven, we sent a letter supporting the review of this, the State Department of Health, right?
Yeah.
Because it's holding up a lot of other people from having an opportunity to use this as a guideline.
It's been going on and Eileen can speak to this. Yeah. And
So
long.
I didn't understand your question.
Well, I'm just wondering what's going on. I mean,
thought you-
this has been carried on for a couple of years or so, I think.
Right.
Because as the Wasco watershed rules and regulations and trying to get the state to review that comment so that other communities could use this document as a guideline.
Yeah, a lot of watersheds are interested in what we're doing here. We transmitted the draft rules and regs to the State Health Department in December of 2020.
Okay.
We did nothing, and we heard nothing until June of 2022. And at that point, they, gave a timeline of when they thought that they would wrap up the review, sharing some of their findings with, the local group. And December, 22 came and went, and they're not even really close to wrapping up the review. So it's been very frustrating.
At the Board of Health, the thing that tipped everyone over is apparently the agricultural rules are the ones they're having to do last.
Right.
And the answer was, since there'll be a new commissioner of health, that they're not going to continue the review until the new commissioner of health is appointed.
That's what they told me.
And that's what I think everybody went, wait a minute, now there's no timeline? So that prompted the board to say, hey, look, you said you'd have this done by this date. Now you're saying date unknown.
And the thing that really is of concern is that the water quality appears to be declining, rapidly if you look at the toxin levels from the harmful algal blooms. So this whole process started after toxins were found actually in the drinking water of Owasco and Auburn. And it took 3 years to go through the process of developing the rules and regs because, it's a real open process. We had focus groups, we had public meetings, we took comments, we responded to comments, so I feel like the county people involved with the process did their due diligence and really, putting together a good product for the state, and for them to take, over 2 years and we still don't have a response. It's really very frustrating. And as we see, the water quality decline, seeming to decline.
As you said, we started it here among us in 17. Yeah.
I believe the county reached out to all the community for some letters of support.
Oh, yeah.
I remember writing one, so
It's been a long time,
yeah, it seems like,
a lot of work.
and now they're saying that's interesting, yeah, okay.
Are we
Thank you for
gonna,
the update.
are we to expect litigation on this in the future? And if so, is that going to be county or state? And that's just throwing that out there.
Depends on how they all shape up.
Yeah.
And it depends on how they're written and what the guidelines are. The good news is we have been working very closely with the Soil and Water, and they're doing their best to try to maintain best practices, educate everyone and give them the resources, try to get ahead of this before it becomes change that we expect to see. Eileen, I see you kind of chomping at the bit. You have your mask on, but I feel like you're ready to talk. But
Is there a question for me?
if you wanted to add to the idea of the litigation issues that possibly come our way,
It's hard to predict.
yeah.
It is.
I think at the end of the day, everyone since I've been on the county legislature and everyone that we've been working with, it's just about compliance. It's not about being punitive. We just want to preserve the health of the lake. End of story. Do everything we possibly can to do that.
Thank you.
Anything else? Say motion to adjourn.
Motion to adjourn. Anyone second it?
I did. She did.
Oh, I'm sorry.
Quick.
Right here.